Hello and welcome to today's WorkSafe Month webinar, Protecting the Mental Health of Small Businesses During COVID Recovery. I'm Stephanie Morawski from WorkSafe Tasmania and I will be your moderator. Before we start, please take a moment to read the following slide about information received today. I will now explain how to participate in today's webinar. Here is a screenshot of the attendee interface. You should see something that looks like this in the upper right corner of your computer. You're likely listening in using your computer speaker system by default. If you would prefer to join over the phone, just select telephone in the audio pane and the dial-in information will be displayed. A video will be played as well during today's presentation without sound. Instead, it will be narrated by the presenter. Please use your questions pane on your control panel to type and submit your questions. Questions will be addressed at the end of today's presentation. Finally, today's webinar is being recorded. I would now like to introduce your presenters, Linda Sheahan from Beyond Blue and Yohana Franklin from Everymind. Linda is the Workplace Engagement Manager at Beyond Blue. As part of Beyond Blue's workplace program, Linda works with industry groups, government, NGOs and others to help build more mentally healthy workplaces. Linda has worked for over 15 years in the sector, including prevention and injury management. Yohana is the project lead that manages the Ahead for Business project for Everymind. She oversees a number of mental health prevention and promotion pilot projects, including those focused on workplace mental health for different industries and audiences. Welcome, Linda and Yohana.
Thank you so much, Stephanie, and thank you so much to you all for joining Yohana and I today. We're very grateful. The purpose of this presentation is to share some newly released free resources designed to help the mental health of small businesses and those people that know them, love them, support them, and work with them. We hear continued feedback about how important collaboration is in the mental health sector. So you're getting two of us together, and we'll also recap for you some great local Tasmanian services, including really good face-to-face options as well. Please feel free to ask us questions, and we're really looking forward to answering those questions for you at the end. And so to get started, we'll briefly introduce our organisations. I'll pass to Yohana.
Thank you, Linda. Everymind is a leading national institute dedicated to reducing mental ill health, reducing suicide and improving well-being. We work across a range of sectors and settings with a real focus on workplace mental health programs. All of our work is underpinned by research, our programs are evidence-driven, and we contribute towards the evidence base to support the mental health prevention and promotion.
For those who might not be familiar with Beyond Blue, we are a proudly Australian not-for-profit organisation whose vision is to help all people in Australia achieve their best possible mental health. We are incredibly fortunate to have really strong support across Australia, including the good people of Tasmania, where we have a community network of speakers and volunteers. Under our current strategy, we have 3 priority areas. Firstly, promoting mental health and wellbeing. Secondly, being a trusted source of information, advice and support. And thirdly, working together to prevent suicide. And here I'd really emphasise the together element and the real importance we put on working with other strategic stakeholders in the sector, including organisations like Everymind and local community organisations in the NT. Tasmania.
So mental health and small business. So what is mental health? The World Health Organization defines mental health as a state of well-being in which the individual realizes his or her own abilities, can cope with the normal stresses of life, and can work productively and fruitfully, and is also able to make a contribution to their community. Mental health relates to positive capacity and our ability to manage our behavior, thoughts, and emotions. An alternative term for mental health is social and emotional well-being, and this is often a term that is generally preferred by Aboriginal and Torres Strait Islander people and those from culturally and linguistically diverse backgrounds. A person's mental health is not always at optimal levels and can fluctuate over time, depending on the influence of different stresses and circumstances. That's why you can view mental health as a continuum, as you can see on this slide, or a range from positive, where you can see the green, healthy functioning at one end, through to severe symptoms of mental health conditions at the other. At the green end of the continuum, people are well, showing resilience and high levels of well-being. Moving into the yellow area, people may start to have difficulty coping. In the orange area, people have more difficulty coping, and symptoms may increase in severity and frequency. At the red end of this continuum, people are likely to be experiencing severe symptoms and may be at risk of self-harm or suicide. It's really important to note that mental health does not equal mental ill health. We will talk about this shortly. It's also important to note here that mental health does not equal happiness. It doesn't mean you're happy all of the time. A mentally healthy person will experience a range of emotions such as anger, sadness, joy, or hope. So what does mental health actually look like? Well, mental health enables our capacity for positive personal development. It enables our capacity to form and maintain positive and respectful relationships. It gives us the ability to identify and manage our own emotions and understand the feelings of others. Mental health enables our skills in communication, and this includes assertiveness, empathy, and negotiation. Mental health enables our ability to solve problems, make informed decisions, and accept responsibility for actions. And lastly, it gives us the capacity to set realistic but rewarding goals and to actively work towards these. So why is all of this important? Well, mental health and well-being has been linked to a range of positive outcomes in other areas of life and human activity, such as improved quality of life, including healthier lifestyles and better physical health, improved recovery from illness, higher educational attainment, greater productivity, employment and earnings, and better relationships and increased social cohesion. So if we are mentally healthy, we feel well, think well, and act well. We realize our own potential. We're able to cope with the normal stresses of life. We work productively and fruitfully, and we contribute to our community. It's useful to remember at this point just how common mental health conditions are. Usually in Australia, it's estimated that 1 in 5 of us are likely to be impacted by poor mental health in any one year. 2 million people live with anxiety and 1 million people live with depression. And almost 50% of us are likely to be impacted by poor mental health sometime over our lifetimes. And tragically, on average, more than 8 people in Australia take their lives each day, 6 of whom are men. Suicide is the leading cause of death for people in Australia aged between 11 and 44, and it's higher than the national road toll. There have been improvements over time, and for example, in the construction industry, there have been reductions in the risk of suicide, which align with better understanding and practice around mental health. So we've come a long way, but it's really important for us to continue on this journey of improved mental health. So why focus on small business? Well, small business makes up almost 98% of all actively trading businesses across Australia. As Australia's largest employment sector, small businesses are an important setting for a focus on mental health. We also know that small business owners, especially sole traders, have an increased risk of mental ill health and decreased wellness due to the business stresses that they may face. The return on investment on workplace mental health programs appears promising. According to a 2014 report by PwC, Beyond Blue, and the Mentally Healthy Workplace Alliance, every $1 spent on successful implementation of actions to create a mentally healthy workplace on average result in $2.30 in benefits gained by the organisation. The analysis revealed that the return may be even more promising for small organisations, up to $15 for every $1 spent. Workplace mental health programs are often designed for large organisations and are not meeting the specific needs of small business. And research conducted by Everymind over the past 3 years has showed that over 77% of small business believe that tailored approaches specifically for small business mental health were necessary. This is a brief snapshot of the research conducted by Everymind. Everymind research with small business has identified small business owners and workers experience depression, anxiety, and stress at concerning levels. And there's high related productivity losses in small business, with people often absent from work due to ill health or working despite having a health-related problem.
Thank you, Yohana. There are also legislative obligations at work around mental health. This includes obligations to proactively protect the mental health of workers, just like our physical health. I won't go into this too much today, but don't forget those obligations are there. So what's the impact of COVID-19 on mental health of ourselves and our businesses? Some of the trends that we're seeing include there's a population level increase in psychological distress, with people reporting to feel isolated and alone. In the most recently released Australian Bureau of Statistics data, almost half of Australians reported to have felt nervous at least some of the time over the recent period. And notably, there was no significant difference there between Victoria and the rest of Australia in this sentiment. So that includes Tassie too, and that's quite remarkable for that period and that data set being the August period as well, when you note that Victoria at that stage was going into the whole lockdown period as well. So generally, people across Australia and consistently have had a fairly hard year. Some of the other insights that we're seeing include there are significant numbers of people who are feeling concerned about their financial security. Many people are experiencing a reduction in sleep and exercise, an increased alcohol consumption, and there are some rising trends around family violence. One sentiment indicator that we've seen reported, which many people feel is quite illustrative of the situation, is that they feel like they're putting on a brave face, but are privately very worried. For workers, we're seeing work insecurity, work loss, rapid work change, and reduced household incomes. Organisations are managing safety changes, changed operating conditions, reduced or changed resources, and increasing distress from the public, customers, and other businesses. The slide now shows an illustration of, and it's just a reminder of how COVID is impacting everybody. It shows a geographic household financial impact index by postcode, and it compares March 2020 with July 2020. So whilst the impacts have been mixed, this is the context we're working with, and it's been a challenging year for most people and particularly for most businesses. So what can we do around our mental health? At an individual level, we know that anxiety and depression are common and treatable. We know that it's beneficial to seek help early, but it's never too late. We know that poor mental health is not a weakness, and we know that by talking openly about mental health, we can help raise awareness and reduce the associated stigma. We also know that work is an important setting to help prevent and promote mental health conditions and keep people healthy and well. So what are some of the individual level strategies that are particularly relevant to help protect and promote mental health during COVID-19? Some of these you'll have heard before, and you're possibly a little bit sick of hearing them, but it includes developing a balanced but adaptable routine, getting good sleep and eating healthy foods, staying physically active, staying connected with family and friends, managing our intake of information, including news and social media, and making use of supports, including family, friends, and professional services. It might sound basic, but the basics are important here, and it's a critical time for us to focus on what we can do. The current slide shows some of the things that we can do around mental health in a work context. And this is important because whilst there's all those individual things that we can do, in work, sometimes there are factors outside of our control individually, and so we need a little bit of help from the others that we're working with. In an organisational context, we've seen really great improvements around encouraging help seeking, encouraging early intervention, awareness around resilience programs and some of the activities we can do there at an individual level, and raising awareness for mental health and wellbeing. On the slide, this is represented by boxes 3, 4, 5, and 6 to the right-hand side and along the bottom. Generally, where there's a good consensus that there's more we can increasingly do about mental health is around the early protection and promotion of mental health. This includes how we can design work to minimise harm and how we can promote protective factors for work at a business level. Put very simply, we refer to this as the integrated approach. This model applies both individually and a work setting and has 3 core elements. It's about protecting from work-related risks to mental health, promoting good health, connection and culture, and supporting people in times of need, including best practice early intervention help. By addressing these 3 elements, we can help people at all stages of the mental health continuum, that lovely green to red spectrum that Yohana showed at the beginning. I've mentioned a couple of times about hazards and protections for workplace mental health. Safe Work Australia has identified all of these in a work context, both the hazards, which are along the top of the slide, and the protections, which will appear now along the bottom. Common workplace hazards for mental health include customer distress, rapid change, exposure to physical hazards, overwork and underwork. During COVID-19, some of the increasing psychosocial hazards we've seen popping up include increasing isolation, increasing work insecurity, poor role clarity, and the impacts of rapid change. Along the bottom, we have the protections that can help buffet and protect people from some of those hazards. These include things like flexibility, participation, connection, and having a good culture. While some of these sound like big business principles, they also apply really well at a small business level as well, and often more so. Many people start small businesses to get that better sense of control. Small business can give greater flexibility and autonomy, and small businesses have a really good opportunity to build effective culture. So how does this play out during COVID-19? What are some of the trends that we're seeing generally and some of the risks and protections? The current slide shows during COVID some of the scalable risks that we're all seeing and facing in a work context. These include change, uncertainty, ongoing potential for outbreaks, economic risk, split teams or having to manage more distancing, and increasing vulnerability. The protections, the evidence-based protections that have been shown to help in this context, and particularly in a pandemic and emergency response context, include clear communication, being open and transparent, really identifying known risks and how we manage them, but also having really open and honest conversations around some of the risks that we're facing. So to give a practical example there, generally if businesses are transparent with their employees around some of the financial risks that they're facing, This has been shown to have been managed and received better within the workforce. People accept that there are challenges and they can then work together to face them, which generally goes down much better than not reporting those challenges at all. From the promote perspective, those businesses where there can be flexibility, where there's connection, where there's that space for culture, and where there can be honest and open conversations about mental health are generally doing a bit better. From a small business perspective during COVID, the real risks that we're seeing at the moment, both today, but these will be common everyday risks, include long hours, cash flow challenges, isolation, and this might not even just be in a physical sense, but the loneliness that can come with being in small business, safety changes, work insecurity, and support. As Yohana mentioned, small business crosses every industry there is, from trades, health, hospitality, arts, tourism, retail, tech, and professional services. In terms of the protections that we've really seen are being effective and helpful this year, it includes those businesses who are embracing the early recovery services available. It can be leaning into budgeting, business support, and planning. Generally, what we see is once businesses start making decisions about taking action, that can be incredibly effective for your mental health. Often it's the waiting, the lack of being sure can be most challenging, but when we lean into those challenges, we can start to feel better for it. There are some great tools, including business wellbeing plans, which Yohana will explain further in the Ahead for Business section. It's leaning into peer networks. From a promote perspective, it includes leaning into physical health, connection, the peer networks again, and developing personal wellbeing plans. And from a support perspective, it's about making time for rest, wellbeing, recovery, and other supports out there. At this point, I'll hand back to Yohana to speak more about the Ahead for Business program.
Thank you, Linda. Everymind has worked with small business and mental health sector to develop and trial a mental health and wellbeing support specifically for small business. This support is called Ahead for Business. Ahead for Business takes a comprehensive approach, focusing on improving overall wellbeing and reducing risk factors for mental ill health amongst small business owners. At the centre of Ahead for Business is a digital hub, which provides tips, tools, checkups and resources for small business owners and those that support them. I will shortly go through the digital hub in more detail. The digital hub is supported by a community engagement strategy. This strategy includes a framework, so regardless of industry or location, a small business community can pick up the framework and implement Ahead for Business. Ahead for Business aims to build the capacity of communities and individuals to respond to the mental health and wellbeing needs of small business owners. Communications is a large part of the Ahead for Business project to support implementation and to inform development, with ongoing collaboration with a mentally healthy workplace at small business sectors. All of the work we do is evidence-driven, and Ahead for Business aims to deliver a research strategy which contributes to the evidence base of mental health and wellbeing for small business owners and to inform future recommendations. For small business and by small business. So throughout the design and development of Ahead for Business, the team from Everymind has consulted with small business owners across Australia to ensure the digital platform met the specific needs of the sector. This was completed through a detailed survey and interviews with small business owners, numerous consultations and focus groups, user testing and qualitative analysis, and an expert advisory group made up of small business owners, industry professionals, and mental health experts. Everymind also completed research to better understand the mental health needs of small business owners and employees, and to assess the acceptability and feasibility of digital approaches to address the mental health and mental ill health within the small business sector. So the Ahead for Business Digital Hub empowers small business owners through a digital business stressor screen, which is an interactive tool that assists small business owners to identify personal stress points and connects them to resources to support the management of these stresses. a digital mental health checkup, which helps small business owners to understand their current mental health and wellbeing status and provide steps for action. An online wellbeing plan, which is a live digital document which can be tailored and updated by small business owners to support them to take action on their mental health and wellbeing. Tailored resources showing stories and voices, podcast videos and case studies of small business owners. An anonymous peer-to-peer forum, which is an online space focused on topics and issues that matter to small business owners. It will also feature expert and business owner Q&A sessions. A dedicated communities hub. This is a structured section which supports and engages and addresses the unique needs and challenges small business owners face according to the industry or location in which they operate. A support directory. This is the section which connects to service providers, organisations and support according to the mental health business and industry needs. And lastly, a personal small business portal, which is a personalised space where small business owners can save resources, results and information and track their progress over time. This current slide and the next one just gives you a snapshot of the business stressor screen and the mental health checkup you can expect to see on Ahead for Business. Small business owners can register for Ahead for Business, take the screens and then come back and track their progress over time. According to your results, you'll be recommended specific resources that will help address the mental health and wellbeing needs of small business owners using the Ahead for Business digital hub. And over to you, Linda.
Thanks so much, Yohana. Beyond Blue has recently released a new free online training course. It's called Mental Wellbeing, Supporting Yourself and Small Business. Like Everymind's program, ours has been co-designed based on extensive consultation with the small business community and following on from extensive research. The free course includes 4 25-minute self-directed lessons, including Lesson 1, which is Introduction to Mental Health, Lesson 2, Look After Yourself at Work and Home, Lesson 3, Check In on Someone, and Lesson 4, Support Small Business Day to Day. The current slides will just show you some of the screenshots of different parts of the course. I'll mention briefly why we developed the training course to give you a sense of how we've got to where we are. We hear again and again that running a small business can be challenging, and with so much to do, mental health and wellbeing often, in reality, takes a back seat. For many, COVID-19 has exacerbated these stressors whilst adding enormously to uncertainty. We get ongoing feedback that small businesses want support where they are. They don't always want to be the ones having to look at another website or do extra work, but the goal was really to help upskill people who know or work with small businesses. Oops. So the training includes interactive activities and content and balances adult learning principles with the busy realities of daily life. It's designed for those who know or work with small businesses and sole traders. So whether you're a small business yourself who regularly works with other small businesses, if you're in a WHS role that often works with other small businesses, or even if a family member, friend, or loved one is in that area. The course is also designed to really complement other services out there, including Everymind's Ahead for Business program, the My Business Health website, if you've done mental health first aid, and all those other great local services and face-to-face offerings you might have. This includes existing small business and mental health training. By focusing more on business-to-business relationships, so how you have a check-in conversation with somebody who might be a client is usually quite different to how you have a check-in conversation on someone within your business. We encourage you not only to check out the training, but to please share it with others also. Oh, I'm so sorry. We've just repeated the slide slightly. I'll quickly now recap on other resources and local help available in Tasmania. So I would really strongly encourage you to get acquainted with these, because many have upcoming and evolving offerings. Some great examples include the Menzies, which includes a co-design workshop this coming Thursday, the 15th of October. You can look it up on Eventbrite, or I'm happy to share the links also, but they're running a co-design workshop around small business services local to Tasmania. The Mental Health Council of Tasmania, Business Tasmania, Better Work Tasmania, the Employer of Choice Network, the WorkSafe Advisory Service, Speak Up Stay Chatty, AusHelp Tasmania and Lifeline Tasmania also have fantastic workplace mental health programs, training and support available. This can include face-to-face upskilling. I'm very grateful for the collaboration and support I've received from these organisations, both professionally and personally, and they're all brilliant people. I'll quickly mention the Coronavirus Mental Wellbeing Support Service. This is a free 24/7 platform which includes connection with professional counsellors, online community forums, connection with local service providers, web chat and digital content. It's specialised for coronavirus, including the economic recovery phase. And you can call not just for your own wellbeing, but for example, if you're looking for tips to help others also and in a work context. So if your business might be too small to have an EAP, it can be a really good option to have on hand if you find yourself in those situations where you want to help someone, but you're not quite sure on the steps to take or what to do. Lastly, I'll really quickly mention in Tasmania, you can go to the Tasmanian PHN website, and there you'll be able to look up all the local service providers by geographic location. So if you go to their online portal, you can click to your nearby location and it will show you a suite of services ranging from workplace training to one-on-one clinical support. And that's looking more at one-on-one services or business-to-business services. And they're a great complement to some of those more prevention-based and awareness-raising services I mentioned on the previous slide. So that is most of our presentation. We've prepared some questions and we've also got, we wanted to open up the floor to have a really good conversation with everyone on the line. So I'll hand back to Steph at this stage and we look forward to having a really great chat.
All right, thank you, Linda and Yohana. So yes, we will take audience questions. So please use the audience question pane to type in and submit your questions. I would also like to remind everyone that this week is Mental Health Week, and on the 10th of this week, it is also World Mental Health Day. So as well as today's presentation, we have run other mental health webinars during WorkSafe month, and we also have other mental health webinars running throughout October. So do head to the WorkSafe Tas month website and have a look at what other sessions we have running until the 30th of October. So a question for Yohana. What have been the experiences of some of the businesses engaging with Ahead for Business?
Yeah, sure. So I think the standout experience has probably been that small business have really felt that workplace mental health supports have not been that helpful for them up until now, because they're really better suited to larger workplaces. So we've seen small business come to Ahead for Business along with other initiatives, for example, the ones that Linda talked about, to be able to start addressing the mental health and wellbeing needs for the small businesses. I think the type of small business coming to Ahead for Business and talking about their experiences really range from those that are starting business and want to be proactive about mental health, all the way through to those seeking interventions either for themselves or someone they may be concerned about and they work with. We have seen, heard from small business engaging with a head of a business that they experience a range of stresses, and some common ones are the financial stress, especially this year, feelings of isolation we hear as an experience, and also working long hours. So these are things we're addressing within the Digital Hub, and we continue to work with small business ready to evolve and meet their needs and their experiences.
Thank you, Yohana. Question for Linda. Could you tell us a bit more about the training? You mentioned it was developed for business advisors and people supporting businesses, but could you tell us a bit more about who might try the training and how it's different to other training out there?
Thank you so much, Stephanie. So the training, we're really proud of it. As I mentioned, it was developed through a lot of consultation. We developed a prototype version last year and then refined it much more with that ongoing business community feedback and small business feedback. In terms of why we targeted business advisors and supporters, I mentioned that we were told again and again that small businesses being so busy, they wanted that real support from the rest of the community, whether it's the other organisations they're working with and also friends, family and other businesses and small businesses as well. So to give a couple of examples, the more we can help accountants and anyone who regularly can see and help and touch and support small businesses, they are identified as a real opportunity area. I think often accountants and financial planners can often see some of those financial pressures that might be impacting small businesses as well. So those range of indicators can mean the more that those regular supports and service providers have that really good mental health competency and mental health literacy, that can help open up other conversations also. As an example, the ATO has also lent some support and interest in the training. I think they also identified as well, the more that anyone who's touching small business can really be that empathetic ear and supporter to small business, it can help problem solve early and lead to some of the solutions out there to just let businesses not only seek mental health support, but some of the practical support to actually unleash the stressors impacting small business. Some of the things we love about the training are it's really user-friendly. It's quite lovely to look at. We developed it in collaboration with Xero, one of our partners, and they were able to use their expertise to really make it user-centric, easy, but also deliver very valuable learnings. And the other, I think, really key point, and I mentioned this before, and sorry to repeat myself, but it's that complementary point of the training. We really don't want to overlap with other training that people might have done or other online training that's already out there. But by really focusing on upskilling those business to business relationships, it's a little bit different and we hope it's a value add. And I'll just repeat again that it's free. So we're really hoping that everyone can get something out of it, give it a try. I mean, I've given it a try and I've found it helpful myself. It just has little practical examples, lovely quizzes along the way, and a real focus as well on protecting your privacy. The feedbacks we've had so far has been lovely also, that it's easy, good focus on upskilling and a complement to other learnings. So we're very proud of it and we hope you give it a try also.
Thank you, Linda. So there's still time to submit your questions to today's presenters, Linda Sheahan from Beyond Blue and Yohana Franklin from Everymind. Please use your questions pane to type and submit your questions. A question that is for both of you. You talked a lot about small businesses. Do the things you've talked about work for sole traders or self-employed people also?
I can answer that first. It's Yohana. So yes, absolutely. They can work for anyone involved in small business. So we have a support for someone else section also. So if you're a family, friend, or someone that supplies or is supplied by a small business, the resources can help you. But there's also a section for people that are sole traders and work on their own often, and whether it's a kind of mental health information and well-being suggestions and actions, they're definitely can help sole traders and people who are self-employed.
Linda from Beyond Blue, I would really support and agree with what Yohana said. We hear often that sole traders, freelancers, sometimes it can be quite challenging. There are different challenges, and occasionally they can get a bit left out of the conversation. So definitely as well, the training has been designed really clearly with sole traders in mind also. To give a practical example, Yohana and I have both referred to the wellbeing plan. This is a really great example that can be helpful for sole traders, freelancers, or small businesses who don't employ others. The personal wellbeing plan, it's a lovely way that you on a good day can help do some planning for where you might be having a harder day and really put into place some of the strategies and things to do where those wellbeing activities can really feel out of reach. So that plan, it's something anyone can do, whether you're a sole trader. It's also employees can do it in a smaller business or a larger business too. Those plans are available on the Ahead for Business website and also embedded within the training that's been developed. So we'd really encourage sole traders, gig workers, freelancers to really get involved and have a look at those great resources also.
Thank you, Linda and Johanna, for that response. Another question, what are some of the upcoming activity areas for small business from Everymind and Beyond Blue?
Hello, this is Yohana. So one of the things that Everymind is doing is there's a community section on the Ahead for Business Digital Hub, and we're in the process of developing it further. We have 9 geographical pilot sites in Australia, and we're working with them to develop specific resources, including 4 rural and remote sites and a bushfire affected site. And the other thing we're working on is with 3 industries at the moment, and we're developing content and tools for those specific industries. And they will also be on the community section on the digital hub. We plan to scale and expand that. So yeah, look out for that upcoming activity. And we look forward to working with small business across Australia to keep informing that and moving it forward.
Thanks so much, Yohana. As for Beyond Blue, some of the probably 3 key examples of activity areas ongoing and coming up that will help small business. It includes ongoing availability of the coronavirus mental wellbeing support service. So that'll be a daily 24-hour reach out service, more targeted around COVID-19 than the existing support service. Another exciting area that we're working on is an increased focus on the link between financial wellbeing and mental health, including some early research there. And the third one, which was announced in the budget this week, the federal budget, that we're really excited about and we think will have a really strong benefit for small business owners, is we have a service called New Access, and we've just been awarded some federal funding to run a national small business owner service. It'll be a free, no referral, low intensity online, so phone or web chat low intensity coaching service with up to 6 sessions available with a coach trained in low intensity CBT and with a small business background. So it's small business helping small business. It's free, it's that no referral aspect, so no need to go to the doctor, and really safeguarding of privacy. And it's been validated to have a really strong recovery rate, so between 70 and 80% for working populations. That service, it's going to be, we understand, likely in 2021, we're hoping early 2021, it'll be open to sole traders also. We're really excited about the service, and the initial feedback since Wednesday has been extraordinary. So we're looking forward to sharing more information there, and we'll be trying to collaborate really closely with all our great supporters in Tasmania to help raise awareness for that new service as it becomes available. But yeah, thanks so much, Stephanie.
Thank you. And then just a final question. Could you give any last advice for small businesses and their supporters about looking after yourself over 2020?
Yes, this is Yohana. So I think my last bit of advice would be make time for self-care, connect with others in some way, whether that's face-to-face or virtually at the moment, if that's all you can do. Make use of all the resources out there, lots of free stuff, and ask your colleagues, friends, families how they're doing, and just keep that conversation open. Everyone is feeling it, so yeah, make time for self-care.
It's Linda here from Beyond Blue. I would really repeat and reinforce everything Yohana said. Personally, I'm based in Melbourne this year, so it's been quite a challenging year, and I hope I can emphasize with a lot of the small businesses and people out there doing it a bit tough over 2020. I think the one thing I'd add to what Yohana said is this is the year to be kind to yourself as well. I think particularly we're at the stage of the year where there's a lot of good signs on the horizon, but a lot of people, they're pretty tired. It's been a fairly long slog, and I think some of the realities are really setting in. So it's much easier to practice self-care when you're kind to yourself as well. A lot of us are often quite hard on ourselves, so really empower your self-care by being kind to yourself also. Use that self-compassion and really just try and chip away at that self-care day to day. So I really hope you could take something away from this presentation today. Maybe one little self-care activity. Maybe we'll set this as a challenge. If everyone could do something for themselves today, whether it's going for a walk, planning something nice for the weekend, doing something with the family, reconnecting with somebody interstate who maybe you've not been able to chat with for a while. But also, if you have found anything here useful today, we'd love you to take it and share it as well. So whether it's letting somebody know about the Great Ahead for Business or the training, if it's sharing a stat or a tip you heard, but the more that you can share this free evidence-based information, that really helps us and can help all of us contribute to making a more mentally healthy Australia. So we'd really appreciate your support, and what Yohana said, keep going with the self-care, and please all look after yourselves and each other. So yeah, thank you so much. Really appreciate your time.
And thank you, Linda Sheahan from Beyond Blue and Yohana Franklin from Everymind. And thank you everyone for attending today's webinar, Protecting the Mental Health of Small Businesses During COVID Recovery. Once you leave today's webinar, you will receive a survey on the presentation. We do appreciate you providing us with your feedback. Today's webinar has also been recorded and will be made available at the end of WorkSafe month on the WorkSafe YouTube page and website. On behalf of WorkSafe Tasmania and the WorkCover Tasmania board. Thank you for joining us. Thank you, Linda, and thank you, Yohana.